Today we can remind ourselves a few things about allergic reactions. There is this word immunopathologies, and we can say that immunopathology is a branch of medicine and biology. And this branch will deal with the immune system disorders. And these immune system disorders may include other diseases that are caused by inappropriate, the word is inappropriate, excessive, or dysfunctional immune responses. So, immunopathology basically is the study of immune system disorders. Therefore, what are the examples of immunopathologies? We have three of them as listed there. The immunopathologies include immunodeficiency. We have autoimmunity, and then we have hypersensitivity. This is the three types of immunopathologies that we know. Immunodeficiency here, an individual's immune system will goes down. It can be caused by a number of factors. Example is chronic diseases. One of the commonest chronic diseases that we know is actually HIV. Another example can be diabetes. Another example can be malignancies. So these are just examples of chronic diseases that can make your immune system go down, what we refer to as immunodeficiency. And then autoimmunity. In autoimmunity, here, your body immune system mistakenly attacks your own tissues. Remember, immune system is supposed to defend an individual from pathogens. And here we can also have diseases. In a situation whereby the body mistakenly attacks your own tissues, then we call it autoimmunity. So when you study immunology in details, you will find that the cells of immune system, particularly the lymphocytes, after production in the bone marrow, the T lymphocytes migrate into the thymus tissue. And when they migrate into the thymus tissue, they are supposed to undergo maturation as well as specialization. In this case, These cells are trained on how to identify its own cells, its own cells, and differentiate them from the pathogens. So in the event that there's a miss in terms of training of these cells, then they may end up mistakenly identifying your own tissues as pathogens and then attacking them. That is immunodeficiency. Not immunodeficiency, sorry, autoimmunity. Another example of autoimmunity is whereby infections can trigger production of molecules of those antigens which resemble those of human being. So you find that a pathogen or an allergen produces molecules which resembles those that are available in the body. So when the immune system will be attacking those molecules that are produced by the allergen, it will mistakenly also attack your own molecules because they resemble those ones that have been produced by a pathogen. A good example is when we talk of throat infection caused by streptococcal infections, streptococcal bacteria. This bacteria produces antigens that resemble some molecules found in the heart, and also in the kidneys. Therefore, when you have this infection, throat infection caused by streptococcal bacteria, they'll produce molecules that resemble those human molecules that are found in the heart and also in the kidneys. So when the immune system will be responding to those molecules, it will as well affect those ones that are found in the heart and in the kidneys. And that is where we have a common disease called rheumatic heart disease. Rheumatic heart disease. That is just an example. So that explains what autoimmunity is. When it comes to hypersensitivity per se is just an exaggerated immune system on an antigen that is actually harmless. The antigen is harmless. So that is hypersensitivity. So here, your immune system will overreact to an allergen which is actually harmless. And when it reacts, it produces inflammatory mediators. Examples can include histamine. Another example can be prostaglandin. Another example can be bradykines, and so on and so forth. So hypersensitivity is just an exaggerated immune response to an allergen which is actually harmless in the body. And it is in this hypersensitivity whereby our topic of today is derived. This is allergic reactions. Allergic reactions. So allergic reactions is actually a product of immunopathology known as hypersensitivity. So let's define immunity. What is immunity? Immunity is actually the body's ability to resist and defend against infection, diseases, or foreign invaders, and these foreign invaders can be pathogens through the immune system. And this immunity can be classified as either innate or acquired. We shall see as we progress. So immunity is just the body's defense mechanism against antigens or pathogens or any invaders to the body. And what is an allergen? This can be defined as basically a substance. And this substance can be harmless to most people, such as pollen, pet dander, or certain foods. So this allergen here, we are saying it can be harmless. When you study immunology in details, you will find that this allergen, it has to be attached. It has the one that is able to produce an immune response. We normally refer to it as an immunogen. That tells you that not all allergens can trigger immune response, and not all allergens are harmful. Some of them are actually harmless. So examples of harmless pathogens can include what we are referring to as the pet dander. A pet is just a domesticated animal, a domesticated animal, and this animal can be a cat, can also be a dog, and so on and so forth. So the material, the molecules that come from these animals are what we refer to as the denters. So these denters are antigens, not antigen actually, allergens, and these allergens are harmless. So when they get into your body, there will be an exaggerated immune response to them, and you'll get an allergic reaction. Allergic reaction. Another example of harmless antigen, we can have something like, let me just rub this on first so that we can proceed. Another example of harmless allergen can be pollen grains. Another example can just be perfumes. So some of you who apply strong perfumes, some people can be allergic to it, and it can trigger an allergic reaction. Another example is just certain foods. Some foods. We have some foods in which some people are allergic to. So those are just examples of allergens. What is an antibody? An antibody is actually a specialized protein. And just even before we define it, it's important to know that an antibody is also known as an immunoglobulin. An antibody is also known as immunoglobulin. And immunoglobulins are usually produced by lymphocytes, and the type of lymphocytes that produces immunoglobulins are what we refer to as B lymphocytes. B lymphocytes. So we are saying an antibody is also known as immunoglobulin, and immunoglobulins are normally produced by lymphocytes, and the type of lymphocytes that produce these antibodies are actually known as the B lymphocytes. And the immunoglobulins, we have five classes. The five classes of immunoglobulins are actually IgE, IgM, IgA, IgD, then we have IgG. These ones are five. This is 1, this is 2, this is 3, this is 4, and then this is 5. So these are the five classes of immunoglobulins that are produced by the immune system cells that are referred to as the B lymphocytes. And on these immunoglobulins, this IgE is the main cause of allergic reactions. Because during the immune system response to an allergen, it is this IgE that will be produced to cause allergic reaction, and this allergic reaction falls under the type of hypersensitivity reaction known as type 1. Remember, we have various types of hypersensitivity reactions. We have type 1, type 2, type 3, type 4, and each type has various mechanisms as well as the related immunoglobulins. When you look at IgM, this one is the first antibody that is usually produced when there is an acute infection. The type of antibody that will arrive at that site is IgM. Again, it's important to know that IgM, in terms of molecular weight, it is actually the heaviest. It's the heaviest, IgM. So let's talk about IgA. IgA is found on mucosal surfaces. When we talk of mucosal surfaces, we are talking about the eye, and that is in tears. We are talking about in the mouth, and this is saliva, among others. So IgA is normally found in mucosal areas. Example is in the eyes and also in the mouth. IgD its whereabouts are not clearly found. It is yet, its details are not clearly or well demonstrated in terms of its role in the immune system. When it comes to IgG, what we can say about IgG is that one, it is the smallest antibody, and number two, it is the one that is found at birth. So newborns are born with IgG, this type of antibody. And what you need to know is that IgG is produced by the mother. It's produced by the mother. And then because of its small molecular size, it can cross the placenta and get into the baby. So the baby will be born with IgG only. These other ones, the child will develop it as the child grows. But at birth, he is born with IgG. And IgG, we have said, it is the smallest of all the antibodies. And this one here, we said it is small, it's produced by the mother, and therefore its molecular size allows it to cross the placenta, and then it gets into the baby. So the baby is born with this type of antibody. We shall see in the subsequent slides to demonstrate the types of immunity to see how this type of immunity is classified. So an antibody is a specialized protein. It's also known as immunoglobulin. It is produced by the immune system. Its function is to identify, neutralize, or destroy antigens. Such examples of antigens can be bacteria, viruses, allergens, among other examples. This diagram here is supposed to show us the classification of the immune cells, and the immune cells are actually produced from the stem cells. The stem cells. And the stem cells are actually found in the bone marrow. In the bone marrow, the stem cells can differentiate, and these stem cells, we sometimes refer to it as multipotent. Multipotent means they have the capacity to differentiate into different cells with different specialization. So the stem cells are also known as multipotent. So from the stem cells, we normally have two lineages, what we call myeloid lineage. And then we also have what we refer to as the lymphoid lineage. Okay. On the lymphoid lineage, we normally get three types of immune cells here. One is the T lymphocytes, just call it T cells. Another one is the B lymphocytes. And then we normally have what we refer to as the natural killer cells. And on the T cells, we also have some subtypes of T cells. Example can be CD4. CD4. Another example is CD8. This is just some examples of T cells. And why are they known as T cells? They are known as T cells because after production from the bone marrow, they normally migrate to the thymus for maturation, differentiation, and training. So T cells, T simply means thymus. So we can also call them thymus cells. And why are the B lymphocytes known as B lymphocytes? These ones, they are normally produced in the bone marrow and they maturate in the bone marrow. And this B here is simply bone marrow. So they are lymphocytes, yes, but after production in the bone marrow, the T lymphocytes will migrate to the thymus for maturation and specialization, while the B lymphocytes will remain in the bone marrow for maturation. So where they maturate gives us the name. The B for bone marrow, where the B lymphocytes maturate, undergo maturation, while the T for thymus, where the T lymphocytes actually undergo maturation. So, yes, so that is it. So now we come to the other group. The other group, this is the myeloid lineage. Here we have five. We have five cells. We have five cells here. And just want to use this arrow so that you can list them. Here we have neutrophils. Here we have eosinophils. Here we have basophils. And then we have monocytes. Sorry, there's supposed to be four. The first three are what we call granulocytes. Why are they known as granulocytes? They are known as granulocytes because they contain granules in their cytoplasm. So what are we saying? For example, if this is your cell, this will be the nucleus, and this space here will be the cytoplasm. And in this cytoplasm is where we have the granules. So the cells that contain these granules are what we call granulocytes. And then we have the monocytes. These ones, they are agranulocytes. Meaning they do not have granules in their cytoplasm. Another example of agranulocytes are these ones here. The T lymphocytes, all of them. These ones also are agranulocytes. So the two types of agranulocytes, we have the monocytes, and then lymphocytes. These ones, they do not have granules in their cytoplasm, while those that have granules in their cytoplasm are what we refer to as granulocytes. Another issue that you need to know is that basophils, these ones here, when they are in circulation, we call them basophils. But when they migrate into tissues, they change their names and we call them mast cells. And these ones are the ones responsible for allergic reaction. And this allergic reaction is actually hypersensitivity type 1. Remember, we have types of hypersensitivity reactions. Another thing you need to know is that the monocytes, when they are in blood, we call them monocytes. But when they migrate into tissues, we sometimes call them macrophages. And they serve functions, immune functions such as phagocytosis, as well as presentation of allergens to immune system in the category of specialization of cells that are known as antigen presenting cells. So that was just the classification of the immune cells. It is the same thing, a repetition of what we have already talked about. So we look at the types of immunity. Immunity can be innate, can be classified as innate or acquired. So when it is innate, this one, you are born with it, and it includes things like the skin will act as a barrier, therefore it's part of the innate immune system. Can also have saliva. Saliva also has antibodies and also acts to restrict pathogens from entering the body. Here you can also have hair. Hair also acts as an innate immune system because it has the ability to trap pathogens. Even urine, the speed of urine, when you are passing urine, it can wash out pathogens. Making an example of one of the innate immune system. And remember, characteristics of innate immune system is that one, it is non-specific. It's non-specific. This type of immune system is actually non-specific. We can also refer to it as the first line. The first line defense immune system. So innate immune system can be non-specific, and it is actually the first defense mechanism of the body. How about acquired? Acquired, as the name goes, it's actually acquired as the individual grows. Some of its characteristics is that one, it is specific. Number two, this type of immunity can also be known as the second line. defense mechanism. Second line defense mechanism, among other characteristics. So, this type of immunity, it is specific, meaning on first exposure, these cells will be triggered and they will develop memory. They develop memory specific to that disease or antigen. When that antigen invades your body a second time, this memory will actually be activated and the immune will be very specific to this pathogen and it will produce a very strong response. That's why we call it specific. So this type of immune system is the second line. It comes in when the first line has been breached. And the acquired immune system can be further classified. If we have acquired immune system, can further be classified into what we are referring to as actively acquired or passively acquired. So this type acquired immune system can be classified into active or passive. So let me just write active here. And when it is active, it can still be classified into two, which is natural or artificial. The same thing here. When it is passive, it can as well be natural or be artificial. So what do we mean? What do we mean by active and passive? In passive, the antibodies are introduced in the body. Here, antibodies are introduced in the body to fight an infection. And when we introduce these antibodies into your body, then we can do it either naturally or artificially. When we do naturally, an example is the type of immunoglobulin IgG, which is produced by the mother, but it goes into the baby. So it is the mother who produces the antibody. These antibodies have been produced from the mother and they are getting into the baby. So this type of immunity is called acquired passive natural immunity. So antibodies are introduced into the body, but in a natural way. When we talk of artificial passive immunity, it means antibodies are manufactured artificially. Antibodies are manufactured artificially, okay? And when they are manufactured artificially, then you are injected. So you are injected antibodies which are manufactured artificially to help you defend against an infection. We shall see examples as we proceed. When it comes to active, in active type of acquired immunity, the antibodies, they are developed by the body itself. Remember here, in passive, antibodies were developed elsewhere and then introduced into the person. And that process can be natural. Example of natural is IgG, an antibody that is produced elsewhere, that is from the mother, and then enters the baby. The same thing when it comes to artificial, the antibodies here are produced artificially and then you are injected. So in passive, antibodies are produced elsewhere. But in active, the body produces its own antibodies. And how do they produce these antibodies? There are two ways. It can be natural or it can be artificial. So let's see, when it is natural, what happens? Here, you can have first exposure. First exposure to an infection such as measles. When you get first exposure to an infection like measles, the body will now develop and produce its own antibodies that will keep memory, such that when you get this infection for the second time, the body already is trained and has enough antibodies to stop that infection. And that's why people have first exposure to this kind of infections. They rarely suffer the second exposure, or even if they suffer, the effect is very minimal. So in active, the body is trained to produce its own antibodies, that is through natural. How about in artificial? In artificial, here, the antibodies or toxoids are produced artificially, and then you are injected. You are injected to stimulate your body to produce antibodies. So in artificial active acquired immunity, antibodies are artificially produced and then the patient is injected. And when you are injected, then your body will be able to produce antibodies and you will be protected against an infection in the event that it occurs. So this is where we have vaccines. We shall see as we proceed. So as we have already explained, passive immunity is actually a type of immunity in which antibodies produced elsewhere are given to an individual. And we said it can be natural. You can be given those antibodies naturally, like the immunoglobulin G from the mother to the baby, or you can be given those antibodies artificially. Okay? You can be given artificially, for example, introduction of antibodies acquired from animals or human beings to prevent or treat an infection. So what are examples of artificial acquired passive immunity? Here we have anti-rabies. We also have tetanus immunoglobulins, also have hepatitis B immunoglobulins, and anti-venom or snake bite serum. Remember we said acquired immunity That's when I can take you back to this slide so that we can get what we are talking about. This one here can be active or can be passive. Can be passive. Here, antibodies from elsewhere, antibodies from elsewhere are given to the body to produce, to defend against infection. And these antibodies can be given either naturally or artificially. When it is naturally, we give an example, IgG. When it is artificial, we also have injections. And the example of these injections are what we have just shown you here. Anti-rabies. One can be anti-rabies. Another one can be the tetanus immunoglobulin. Another one is hepatitis B, and antivenom. Here, all these are immunoglobulins that are produced artificially, the antibodies, and therefore are given directly through injection as part of passive immunity, so that you can be able to be defended against an infection. Meaning, you don't have this, you can't produce this. So you are given artificially. Naturally, we have IgG from the mother to the baby. So those are the examples. When it comes to active, we are saying this is where the body is triggered to produce its own antibodies. And we said, maybe we can repeat. In a passive, antibodies produced elsewhere are introduced in the body to trigger or to protect against infection. And how do we introduce them? It can be through natural or it can be through artificial. Antibodies from elsewhere into the body. How about active? In active, the body is triggered to produce antibodies. Here, you don't produce antibodies elsewhere. No. Here, the body is triggered. The body is triggered to produce its own antibodies. And we can trigger your body to produce antibodies through two ways. One, we said it can be natural. And two, we said it can be artificial as well. Remember, natural, but you can see the differences as we proceed. So when we trigger your body to produce antibodies naturally, example is first exposure to an infection such as measles, and then the body will be trained to produce its own antibodies against this disease. Meaning, in the subsequent attack, the effects will not be severe. And when it comes to artificially, you are injected some toxoids to trigger your body to produce antibodies against that infection. And that is where we have active immunity. And we are saying that this is where the body is triggered to produce its own antibodies. It can be naturally acquired, like we have explained here, as well as artificially acquired, as we have explained here. So let's look at the examples. Let's look at the examples of artificially produced antibodies. So here we have BCG. So you are injected with a BCG vaccine that contains molecules from this particular, related to that particular disease. And when you are injected, your body is stimulated to produce antibodies or immune system against TB. So this one is normally given mostly in children some weeks after birth. You can also be given measles vaccine. Remember, measles vaccine is different from exposure itself. So if you have never suffered from measles, then you can be given a measles vaccine, and that one will be the artificial method of inducing active acquired immunity. But if you got immunity through first exposure, then it will not be artificial. It will be natural, active, acquired immunity. Another example of artificial acquired active immunity, we give polio vaccines. We also give tetanus toxoids. You need to know that there's a difference between tetanus toxoid and tetanus immunoglobulin. Let me go back so that we can get to know what I'm talking about. Tetanus immunoglobulin is given to a patient who has an active injury. For example, you have a cut wound and therefore we want to give you antibodies that will help you fight tetanus. So what you normally inject patients after exposure to an injury, maybe it can be a cut by a metallic substance, is known as tetanus immunoglobulin. Tetanus immunoglobulin. And this one is passive, artificial, acquired immunity, which means we are already giving you the immunoglobulin that are already manufactured. So their work is just to attack any tetanus infection that will come from this wound here. So that is tetanus immunoglobulin. Then what about tetanus toxoid? This one here. When we talk about tetanus toxoid, this one you are actually given a toxoid like in pregnant mothers, expectant mothers. Here, we want your body to generate immune system against tetanus infection. Remember, in tetanus immunoglobulin, we gave you antibodies because you have an injury, and therefore we want to attack any tetanus infection from that injury directly. But in tetanus toxoid, this patient has no infection, this patient has no cut, he or she is an expectant mother, therefore we are giving the tetanus toxoid so that we can prevent or we can make the body stimulate the antibodies against this tetanus so that during delivery, the mother and the child are protected against tetanus infection. So you will realize in tetanus toxoid is an example of active immunity, which means it's given to the mother so that the mother can produce antibodies against tetanus. But when it comes to tetanus immunoglobulin, this one here, these are already antibodies and they are given to the patient who already has a cut. And therefore now this one becomes artificial acquired passive immunity. So those are the differences that you need to mark. So what is an allergic reaction? Allergic reaction is the body's immune system which is overreacting to a normally harmless substance, which is normally called an allergen. And we have given examples of allergens. We can have dust, we can have animal wool, we can have perfumes, pollen grains, as well as some types of foods. In terms of foods, we have majority are allergic to some type of proteins, maybe fish, maybe meat, and so on and so forth. So how does a patient with an allergic reaction present? These patients can come with sneezing. These patients can come with itching. They can come with a rash or a hive. They can come with swelling or what we call angioedema. Can find patients swelling on the lips. That is angioedema. Some of them can come with a difficulty in breathing, and this is where we call bronchospasms, or even asthma. This one here. There's a note here that an allergic reaction can lead to an anaphylaxis. So, anaphylaxis, this one here, anaphylaxis, this one is a very severe complication of allergic reaction. And actually it is a medical emergency. So anaphylaxis is a complication of allergic reaction, mostly type 1 hypersensitivity reaction. So it is a medical emergency. These patients will come with very severe hypotension. When you check the pressures of these patients, these pressures will be very low. If you check the BPs will be very low. Yeah, these patients here. So it is a complication of what we call the allergic reaction, and it is a medical emergency because these patients will come with severe hypotension. They can even come with closure of airways. These are some of the symptoms that makes this condition a medical emergency. So let's look at the pathophysiology of allergic reactions. Pathophysiology. The word pathophysiology comes from two words. We have the word pathology, and we have the word physiology. Pathology is the study of diseases. Physiology is the study of normal functioning of the body. So when you take patho plus this one here, when you take patho plus physiology, then we end up getting what we call pathophysiology. And what is pathophysiology? It is therefore the study of the functional changes in the body that will occur as a result of a disease or medical condition. So pathophysiology, you are studying the changes in the body which have been triggered by a disease. That is a combination of pathology and physiology. So what happens, the changes we are talking about in this condition, is that in the first exposure to an allergen, the immune system mistakenly identifies it as harmful. So it's important that you get the steps. Number one, the first exposure. These patients who have allergic reactions, they normally have first exposure. For example, if you are allergic to perfumes, so you will be exposed to perfumes for the first time. When you get exposed to the perfumes for the first time, your body will identify these perfumes as harmful. Yet these perfumes, what we are calling the allergens here, are actually harmless. So in the first exposure, there will be no reaction, but the body will identify it as harmful, and therefore it will produce antibodies, and example of these antibodies is IgE. So this IgE will keep memory. We call it memory. So this IgE will keep memory to these perfumes. So when you get a second exposure, now these cells, the memory that is installed here, will respond. And when it responds, it will respond strongly. It will respond strongly and exaggerated. And when it responds strongly and exaggerated, this is when now the patient comes with these symptoms. It can be swelling, it can be itchiness, it can be airway closure, and so on and so forth. So in the first exposure to allergen, the immune system will mistakenly identify it as harmful. Then the B lymphocytes will produce IgE that will attach to the mast cells to keep memory. And then in the second exposure, the allergen will bind to IgE antibodies on immune cells, and this will trigger production of histamine plus other inflammatory mediators. So in the second exposure, we have said the body has produced memory already in the first exposure. Therefore, in the second exposure, the allergen will bind to IgE. IgE is an antibody which was produced in the first exposure, and it has memory. So in the second exposure, the allergen will attach to it. It could be the perfume. It will attach to this antibody. And then after it has attached to it, it will trigger the mast cells to produce histamine. And remember, we said histamine is an example of inflammatory mediator. So it is this histamine that will produce all symptoms of allergic reaction. One is swelling. This swelling is the same as inflammation. We have also said these patients will come with itchiness. These patients will come with airway problems, it can be closure, and so on and so forth. So it is histamine, this one here, that is causing the symptoms that the patients with allergic reactions present with. And that's why we give medications called antihistamine to block this histamine from producing these symptoms. We shall see as we proceed. So this diagram here shows us the sequence of allergic reactions. So the antigen will get onto the surface of the body, and then it will be picked by the antigen presenting cells. antigen presenting cells. It is normally abbreviated as APCs. Examples of these antigen presenting cells, we have dendritic cells, dendritic cells. Another example can be macrophages. In the eye, the type of dendritic cells we have Langerhans cells. So on the tissue, we have antigen-presenting cells. Remember, when we were looking at the cells of immunity, we said monocytes can migrate into the tissues. And when they migrate here, they can be antigen-presenting cells and also macrophages. So all over the tissue, we have antigen-presenting cells on the surface. And every cell, as we saw, it plays a role in the immune system. So when the antigen gets onto the surface of your body, it will be picked by the antigen-presenting cells. And how does the antigen-presenting cells work? They work in two ways. There is something called MHC. MHC is actually known as major histocompatibility. Compatibility. And MHC is divided into two. We have MHC class 1 and we also have MHC class 2. Major histocompatibility class 1 and major histocompatibility class 2. What is the difference? Major histocompatibility class 1 is a molecule that picks antigens from intracellular, inside the cell, and present it to CD8. CD8, remember we said we have types of T lymphocytes. We have CD8 and CD4. So major histocompatibility class 1 is a molecule through which antigen-presenting cells present an antigen that is originating from inside the cell, inside here. And that's why after picking the antigens produced inside the cells, it actually presents to the CD8. And that's why CD8 cells are also known as cytotoxic cells, meaning they kill infected cells. And a good example in this case is when we have maybe malignant cells, sometimes when we have viral infections. Viral infections are unique. A virus enters inside the cell for it to multiply. So a virus, the way it multiplies in the body is different from bacteria. Bacteria multiply extracellularly, while the viruses multiply intracellularly. What do we mean? For example, if I have my cell here, so the space outside here is extracellular, while the space inside here is intracellular. So for a virus to multiply, it has to get inside the cell. For it to multiply because it requires components from the DNA of that cell for it to multiply. But for bacteria, they just multiply outside the cell. So that's why antigens produced inside this cell, we call them intracellular antigens. And those are the intracellular antigens that are usually picked with by major histocompatibility class 1 and presented to CD8 cells, which are a type of lymphocyte cells. That is why they are also known as cytotoxic cells, because once they pick this antigen from inside the cell, then the CD8 cells, they identify this cell as faulty, and therefore they will kill it. They will kill the entire cell. How about major histocompatibility class 2? This one picks antigens that are extracellular. And when they pick these extracellular antigens, they use antigen-presenting cells to present these antigens to CD4. Remember, we also talked about the lymphocyte classes, subclasses, and we said we have CD8, CD4, and even natural killer cells. So, major histocompatibility class 2 molecule presents, using the APC, they present antigens to CD4. And CD4 does not kill cells. It just modulates. It actually modulates the immune system. And what do we mean by modulation? This is to produce chemokines and attract more immune cells towards that site where we have an injury. So that is the difference between CD8 and CD4 in relation to major histocompatibility class 1 and major histocompatibility class 2. So when you do a full hemogram and you find lymphocytes are increased, it is because of these facts that you have explained here. You see, CD8 responds to intracellular antigens, and they are cytotoxic. While CD4 will just modulate. It will modulate immune system by actually attracting more cellular immune cells towards that site. So what will happen in this diagram as shown here, let me just wrap this before we proceed. Okay. So the antigen will get onto the surface of the body. It will be picked by antigen presenting cells. Because these antigens are extracellular, they will be presented to CD4 cells. So the CD4 cells, let me just use this one right here. Allergen will get onto the surface of the body, They will be picked by antigen presenting cells. These antigen presenting cells will present those antigens to CD4 cells. The CD4 will produce chemokines, and these chemokines will attract other immune cells to the site of that infection. Example of these immune cells are B cells. These are B lymphocyte cells. And what will happen is that the B lymphocyte cells will now produce IgE, which is an antibody. And this IgE will trigger the mast cells. It will trigger the mast cells. And these mast cells will produce what we call histamine. which is an inflammatory mediator. This histamine will now produce allergic symptoms, what we call swelling, because it's an inflammatory mediator. Swelling or just inflammation. We shall also have something like itchiness. We have something like airway issues, like closure of airways, and so on and so forth. So that is the cascade. An allergen will get onto the surface of the body. There, they will be picked by an antigen-presenting cell. The antigen-presenting cell, because the allergen is extracellular, it will be represented to CD4 using major histocompatibility class 2, MC major histocompatibility, sorry, it is major histocompatibility class 2. Remember, class 1 responds to intracellular. So in this case, we are not using intracellular allergens because our allergens are coming from outside, extracellular. So the allergen from outside gets onto the surface of the body. We have antigen-presenting cells on the surface of the body. They will pick that allergen and they will use major histocompatibility class 2 to present it to CD4 cells. The CD4 cells will modulate immune system by attracting more immune cells towards that side by use of chemokines. And these chemokines will attract some of those cells, the immune cells we have talked about. Example of those cells is the B lymphocyte cells. Once the B lymphocyte cells get onto that side, they will produce IgE. Remember we said the B lymphocytes produce antibodies. We talked of IgE, IgM, IgA, IgD, and also which one? IgG. So out of these 5, what will be produced is IgE, which is responsible for immune response. That is an allergic response type 1. That is hypersensitivity type 1. So once IgE is produced, it will trigger the mast cells to produce histamine, and then histamine will produce those symptoms which the patient will present with. So when you give antihistamines, you are blocking this route here. When you block this route, then it means the patient will not present with those symptoms. So this is all about that is demonstrated by this diagram here. So allergic reactions, we have seen, they cause symptoms through production of histamine. Allergic reactions produce symptoms through two ways. One, production of histamine. And we have already seen. And before even I go far, let me just remind you that histamine is produced by mast cells. And remember we said mast cells, they are just basophils. These basophils, when they are in the circulation, we call them basophils, but when they migrate to tissues, we call them mast cells. And remember we said basophils and lymphocytes, no, not lymphocytes, basophils and neutrophils, together with eosinophils are known as granulocytes. And they have granules in their cytoplasm. So it is these granules in the cytoplasm of basophils, which are just mast cells, that produce histamine. histamine. So meaning the granules of mast cells contain histamine. So when IgE is produced, it will trigger mast cells to actually expose these granules and burst and produce histamine. So that is the point that you need to remember. Back to what we were explaining. We had said allergic reactions will produce symptoms through two ways. One is production of histamine, which is through degranulation of the granules, which are found in the cytoplasm of mast cells. Another way is through the cascade. Another way is through this cascade, whereby an injury triggers phospholipids to produce arachidonic acid. So we can call it the phospholipase, or we can just call it the arachnoid or arachidonic pathway. So remember, histamine is just one example of inflammatory mediator. Arachidonic pathway gives us other inflammatory mediators, and the example is prostaglandins. We also have things like thromboxane. We also have things like leukotriene. So in allergic reactions, the inflammatory mediators include one, histamine, the first one. Two, you have leukotrienes. Three, you can even have prostaglandins. So the histamine are produced by mast cells directly from its granules, but leukotriene with these others, you can even have thromboxane here. Leukotriene plus these others come from this process we call the arachidonic pathway. So let's see what happens in arachidonic pathway. In arachidonic pathway, let me just delete this so that I get space to write something. When there is an injury to the tissue, and that injury here is caused by a reaction, inflammatory reaction caused by mast cell histamine. Once this histamine is produced, it will create a reaction. That reaction on top of the cells will be perceived as an injury. And that injury will trigger the tissue. And in this tissue, we have an enzyme known as phospholipase. We have phospholipids, phospholipids. These phospholipids, there's an enzyme called phospholipase. Phospholipase A2. This enzyme here. So this enzyme will trigger the phospholipids to produce a substance known as arachidonic. So this substance here will take two parts. The part one, it uses the LOX end, we call it the LOX pathway, and part two, we call it the COX pathway. And this COX can be, you have two, 1 and 2. Okay? LOX in full is just lipo-oxygenase enzyme. Lipo-oxygenase enzyme. While COX is just cyclooxygenase enzyme. Cyclooxygenase enzyme. So from this pathway, you will get all the leukotrienes, which are part of the inflammatory mediators. And here we have types. We have LTB, and they are labeled here. LTB4, we have LTC, and we also have LTB. This is just leukotriene. All of them are leukotrienes. This is 4, this is 4. Leukotriene E, 4. So abbreviation of leukotriene is just LT. So, and on this pathway, we will have prostaglandins. And there are also subtypes. We have prostaglandin D2, then we also have PGE, prostaglandin E, and then we have also BG1 as well as thromboxane. So here you can see now you have leukotriene and prostaglandins to add on histamine. Remember we said inflammatory mediators, we have histamine, leukotriene, and also prostaglandins, among other examples. So histamine, we saw how it is produced from the mast cells, while the leukotriene and prostaglandin come from this pathway here, what we call the phospholipids pathway. So when you give your medication, for example, if I give you steroids, they will block this route here, the phospholipase route here. So meaning all this cascade will not happen, you will not get leukotriene, you will not get prostaglandin. Just before I go there, let me just list here medication of allergic reactions. We have steroids. An example here is prednisolone. We have antihistamines. Example here is cetirizine. We can also have what we call the mast cells stabilizers. And here an example can be ketotifen. And then lastly, sometimes you can have atropine. This one is normally used in medical emergency, which is a complication of allergic reaction known as anaphylaxis. So how do these drugs, how do they work? The steroids will work by blocking this cascade here. They will block the phospholipase enzyme, this route here. So all this cascade down will not happen, meaning we will not get inflammatory mediators like leukotriene and also prostaglandins. So when you give steroids, they work here by stopping this phospholipase pathway, meaning the cascade down here will not take place. Therefore, we will not have this inflammatory mediator, which we call leukotriene and prostaglandins, which contribute to inflammation in the allergic reaction. So that is how our steroids work. And how does so we are done with this one. Now let's look at the antihistamines. How do they work? Antihistamines, we have two receptors. We have H1 and H2. So H2 is found in the gastric tissues. But H1 is the most responsible one for these allergic issues. So our antihistamine blocks this type of receptors, the antihistamine 1. So it will block these receptors. Remember, once histamine is produced, this mediator has to go and bind on the histamine receptors that are on the cells for them to produce the cascade of inflammation. So when you give your antihistamine, they block H1, which is histamine type 1 receptor. They'll block this receptor here. Therefore, even if you have produced your histamine, it will not be able to bind on these cells, and therefore you shall not have allergic reaction. So your antihistamines work by blocking those receptors. And how about the mast cell stabilizers? The mast cell stabilizers work inside the mast cells by stopping production of histamine. Remember, histamine is produced by mast cells. So if I give you mast cell stabilizer, they will go direct to the mast cells and they will stop the mast cells from producing histamine. So mark the difference between antihistamine and mast cell stabilizers. For antihistamines, they block the receptors. In this case, histamine has already been produced, but they come and block the receptors on the cells. So that histamine will not bind on the cells. But for mast cell stabilizers, they work inside the cell. So they stop production of histamine by those mast cells. How about atropine? Atropine works by vasoconstriction. Vasoconstriction. Remember, when you have a complication of allergic reaction, what we call anaphylaxis, these patients come with hypotension. And this hypotension is as a result of vasodilation. And this vasodilation is caused by histamine. And this histamine, you know where it has come from mast cells due to an allergy. So when we give atropine, it causes vasoconstriction, which is an opposite of vasodilation. So histamine causes vasodilation. Vasodilation causes hypotension. Hypotension gives you anaphylaxis. So for us to rectify the vasodilation, we give atropine. Atropine will enhance vasoconstriction, and therefore it will help in gaining the blood pressure and stabilization. So these are just a list of the drugs that we have already mentioned that are used in the treatment of allergic reactions. As you can see, we have steroids, we have antihistamines, we have mast cell stabilizers, we have atropine, and we also have leukotriene. I forgot to tell you something about the leukotrienes, how they work. When you look at our previous casket, where we have injury to the tissues to trigger phospholipid using phospholipase A to produce arachidonic acid. This arachidonic takes two parts. There is the COX pathway and there is the LOX pathway. Here you will get prostaglandins. prostaglandins, which are inflammatory mediators like histamine, but here we will get leukotrienes, which are also inflammatory mediators. So the leukotriene receptor blockers, they work here in this route. These leukotrienes are normally blocked from binding to cells. Therefore, when they are blocked, then the cells will not undergo inflammation. So the leukotriene receptors work in this route, the LOX route. Remember, LOX we said is just an abbreviation for lipoxygenase enzyme. This is an enzyme, while LOX is just cyclooxygenase enzyme. So that is how the drugs for allergic reactions work. That marks the end of this particular presentation on allergic reactions. At least we have reminded ourselves something. Without much ado, just want to say thank you. Remember to subscribe to our channel. You can also send a comment. You can add any material where we have forgotten as we make this presentation more interactive. So thank you. Let's meet in the next presentation.